Dr. Mahomva, what's the current status of our COVID patients?
We still have 46 cases. It's a great news that we didn't record any more new cases. But of importance is, as you know, the nation, we're pushing to test as many as we can. Of course, we're challenged by the kits, the PPEs and so on, but we continue to push. And now we have tested over 14,000. That's a milestone. We are really ramping up despite the challenges, and we're happy that the cases had gone up, but they seem to have stabilized again. We continue to watch and see how we go.
And then coming to the 24 active cases that we have, what's the current status of these patients?
They're all doing very well, actually. And I want to remind the nation that, as we've always said, it's only 5% that will require that intensive care support, high dependency unit support. The rest, about 85%, they're just mild. They get managed at home, self-isolation at home, and they do well. So this is what we're seeing with those cases that we have. And this is once again why we're seeing a large number now really classified as recovered. Remember, recovered means you have had a PCR test redone, and then we have it again within 24 hours. And if you've cleared, we say you have recovered. So we're beginning to see large numbers recovering because these were identified so much earlier. And now we are. So we're very happy that we continue to get very mild cases. When we started, that's for some reason when we had those, the few, in fact, that went on to die, that really had complications. They had other problems in their lives, comorbidities we call it, and of course we unfortunately couldn't save them.
Coming to you, Dr. Chirisa, there have been many myths circulating around ever since, and then one of them has been the fact that children are immune to COVID-19. How far true is that?
Kids are being affected. They are not immune. I think that is the take-home message. And we love our little ones, and we want to protect them. Mm-hmm. And I think this is the effort that we should, this is how we are really looking at it, that we want to protect our little ones, despite the spread of this virus all over the world.
There's been an issue which has been topical.
Sure.
Should children wear masks?
The answer is yes and no. Masking, even for us adults, I know, a lot of us have been struggling with these masks. And this is why, early days we'd find people wearing them, having the mask, but the nose is left out. Mm-hmm. Because naturally, it dries out the air that you breathe. And also it's very uncomfortable. But it also reduces the, freedom of movement of the air. Mm-hmm. But, it's a necessary evil, so to speak. Okay. But our little ones, especially those under 2, we are concerned that, they already have very narrow airways, very small airways. And any small change, like a mask, to them, because of their size, it is amplified. And more so the very little ones, especially those under 2. Mm-hmm. In any case, it's going to be very difficult to even maintain a mask on a 2-year-old. And so, if you look, when we talk about masking, we are not stopping the virus. We are reducing the risk.
The risk.
That is the key message. We are reducing the risk. Hand washing, masking. We are trying to reduce the risk, as we are sitting a meter away from each other. You are masking, I'm masking. So the thing about little children is that they also have to participate in the risk reduction. But in those under 2 years, the risk of, the effect of the mask is much worse. It is amplified, it is bigger.